I want to appeal to members of the public to desist, and I have said this almost in every meeting that we have had, almost in every press conference. We have appealed to people to desist from any form of misinformation. I think you are all alive to what that the social media has been abuzz with all sorts of rumors, including that we are locking down Nairobi, that we are sending people home, that we are doing this and we are doing the other. Things that have come from nowhere, that we are deploying the military. You know, these rumors must stop. They must stop. And I think that members of the press, I would appeal to you to make this very obvious and to highlight this matter. And the reason why it is so important for us to do so is because when you tell people in social media to stay away from a hospital or to stay away from an area because there are suspected cases there, and it is false, one day it will be the truth, and people will still think it is false. You all know the story. I don't know whether you do. You all know the story of the boy and the leopard. It's an African story. This is what is happening today. We have got people who are spreading malicious rumors, falsehood within the internet, and I'm appealing to them to stop. But because we are aware that empty appeals will not work, we will proceed to arrest a number of them just to prove our point. And of course, since they will have something to report regarding coronavirus, we'll oblige them by taking them to Bagathi, where they can report the matter, because, you know, that's where the issues of coronavirus can be handled. So they can go and visit and give their reports there. I still want to appeal to Kenyans for them to remain calm and not to cause panic. In fact, it is persons in the social media who are causing concern and panic among citizens. And to say this, as long as we do what we are saying, if we are disciplined enough to follow what the government is saying, then we will contain this transmission. That is what has happened to the countries that have contained it. They have behaved very responsibly, and they have managed to avoid situations that could have been catastrophic. This is a challenge we have. We have no doubt that if we behave well, we will avoid the kind of scenarios that we are seeing in other countries. But if we do not adhere, and if we do not follow what the government is appealing to do, I can also tell you that the results will also show. Actions in this case, behavior in this case, has its consequences. As His Excellency, the President, assured you on the day that he spoke to the nation, we have been faced with many a crisis before. And even this one, we will face in a similar format, with fortitude, with calmness, with unity, with cooperation. I want to thank all those who are taking their own initiatives to ensure that we are all involved in the fight against this disease and this virus. The business community, the non-governmental organizations, you members of the press, I want to state that we are very grateful to all those who are coming out to support our cause. I want to take this opportunity to appeal to members of the public to utilize the free number that we have said, and it is working. You can call the number 719, and when you are reporting a case, this is the number to call, and we are urging people to call them instead of calling individuals within the Ministry of Health. I want to stop there and take one or two questions, and release.
That's it. Yes. One question. What is the efficacy of these masks that people are using in town, and what would be the advice from the ministry, noting that from your statements since yesterday, you've been saying that you're having to learn so much from China, and we saw that that one people are wearing so many masks that you are going out alone. What is the efficacy? And number two, are we looking at one question, please, setting up temporary hospitals with regard to your announcement of screening starting this Saturday?
Okay, I will explain the second one and then ask Dr. Amoth to respond to the issue of masks. But even as he responds, let me also say this. Long before coronavirus was here, the Chinese were wearing masks. It is almost as you wear a tie, they wear a mask. You know, so, but I'll let him respond to that particular one. On the matter of whether we intend to create mobile hospitals, we are not there yet. We haven't gotten there yet. We have got sufficient quarantine facilities. As I said, we are working with KMTCs, and they are all over the country, and they have got a huge capacity to quarantine people if there was necessity of doing so. But at the moment, we are quite happy with the exercise of self-quarantining. We have also infused a mobile-based system where once you come to the airport, and you must sign the declaration form indicating your number and your physical location. But once we have your number, we are able to keep tabs with your number 24/7. I think it is good to know that your number, we will keep knowing where you are at all times. You know, so it is important to note that. But we have not yet gotten to the point where we are thinking about other measures. As you yourself have said, if it came down to it, yes. But right now, it's not necessary. Yes, let me let Dr. Amoth answer to the question of masks first.
Thank you, Waziri. Masks are important, and let me make this very clear to the media and the public that the use of masks is only for two particular indications. One, if you are unwell, to prevent you from passing the droplet to whoever is taking care of you. Or two, if you are a healthcare worker who is taking care of somebody who is sick. Otherwise, use of masks gives you a false sense of security that then leads you, and because you are not used to wearing a mask every day because you are not a surgeon or a doctor, you end up in trying to adjust the mask, touching your face, your nose, or your eyes, which puts you at even a greater risk of transmission of COVID-19. And on top of that, if you are well otherwise, you are wasting a useful resource, which is very hard to come by now. Please, let's keep the mask for those of us who are unwell and the healthcare workers so that it can serve its intended purpose. Thank you.
Namaswa? Thank you very much. I'm Namaswa from KTN. Our investigative team was following up on a tip about a Kenyan who supposedly came from Lisbon, went to Serena and refused to self-quarantine, and police had been called to intervene. Anything about that?
Thanks, Mark, again. That information reached us yesterday through an informant who informed us of this gentleman who came from Lisbon on Sunday last week and has been all over. I think he was even chased from Windsor Hotel. Immediately, in conjunction with the security apparatus, we circulated his number, and eventually we caught up with the gentleman today at Serena Hotel, and we transferred him to the Mbagathi isolation unit for isolation and testing to confirm his status.
And I did say yesterday, Namaso, I did say that if, and I appeal to the members of the public to also help us with the policing, and you can see it is working, you know, and we are thankful to those members of the public who said that and who called us. And of course, we will keep the gentleman, you know, in isolation by force. If you cannot do so voluntarily, then we will keep you in isolation by force. And it is not necessary. It is very irresponsible for a person to know that they could have been exposed, and then they start going around dancing clubs. Honestly, you know, and that's why we are telling members of the public, you know, let us not accept. Having said that, I also want to say that you should not take the law into your own hands. You are not, if you are not a policeman, if you are not a health official, do not take the law in your own hands. I have warned before against profiling and xenophobia. And we have heard of a situation in Kwale, of a situation in Kwale, where people even beat up somebody just thinking that they might have a coronavirus, not knowing that those who are beating the gentleman up might be the ones themselves with the virus. Because unless and until you have been tested, nobody knows whether you have it or you don't. So it is very unfair. It is not right for anybody to be treated as such. So let's balance it. If you are supposed to quarantine yourself, quarantine yourself. If you leave your quarantine facilities, we will know, especially going forward. We will know. And once we know, we have no choice but to quarantine you. But we are hoping people are going to behave reasonably. Finally.
Yeah.
Yes.
I just need a clarification. Out of the 8 that you say you have found out, are they part of those that have been quarantined? And then someone again, the head of the public is asking whether testing is free out there and whether how many testing kits have been.
Okay, as far as the testing kits are concerned, we continue to buy as necessary. As you know, it has been in the media that the philanthropist Jack Ma has sent us through CDC some 20,000 testing kits. But even locally, we have continued to purchase locally. We have not run out of testing kits so far. What was the second question again? What was your second question, sorry? Testing is free. Testing is free. Nobody is being charged.
Then the last one, are the 8 cases that they have done negative?
No. What we are doing is that every day there are people, we pick people up, like for example the gentleman that you have heard. So some of them are the ones that we had even yesterday, some of them. We have got new ones today. So every day is a changing situation. As they come in, the ones we think we need testing, we test. Final.
The World Health Organization yesterday said it is worried that the numbers in Africa will not be the position.
Your name?
My name is Stephen Leto from Citizen TV. The World Health Organization yesterday questioned the number of positive cases in Africa, saying they could not be a true reflection of testing capacity. Should Kenya worry about the numbers that Waziri you are giving?
I don't think so. Not for Kenya. I can't speak for other countries. But I can tell you that for Kenya, we are confident about what we are talking about. You know, also, we must stop looking down upon ourselves. You know, we cannot be we cannot be called banana republics 50 years ago and still continue to be called banana republics. You know, they used to say we are going to be overwhelmed by the circumstances we are going to face. Maybe. You know, God is our protector. Maybe, maybe not. But it is also good to acknowledge that even the so-called able people are also totally overwhelmed. All right? So let's not always believe in what somebody out there. They've got a very dismissive attitude about what we are able to do. So let's not look down upon ourselves. Let's behave. If we behave, we will prove them wrong. Thank you.